Hi guys, today we're going to talk about tennis elbow. Now this is a bit of a hot topic because so many people suffer from it, both in tennis and in paddle. And this is something that we see a lot at the club, is that players giving other players advice or coaches giving advice when they might not know the best course of action themselves. I'll be the first person to admit I'm not a doctor or a qualified physiotherapist. I do have a master's in biomechanics and I am a sports therapist, but if you want a medical or scientific opinion or diagnosis, then please go and see a doctor or qualified physio. So in this video, we'll go over the cause and a few solutions that hopefully will help you with your tennis elbow in the future. To begin with, tennis elbow is actually called lateral epicondylitis, and that's something that basically is saying you've got an inflammation of the tendons around the elbow joint. Golfer's elbow, which is actually on the medial side, the inside of the forearm, and tennis elbow, which is on the outside of the forearm, they're actually very similar and would be solved in similar ways. So this is caused, both of them, by excessive repetition of the same action. So that means that you're obviously doing something that is aggravating the tendons around that joint. This aggravation is often caused by over-squeezing of the hand. Now that's something that it's made even worse if your hand is not in the right position on the grip. So a couple of things to look at with the grip. First of all, is your hand on the grip? You'll see players where the hand drops off the end of the racket, and you'll even see pros doing this, where the last couple of fingers are off the end of the racket so they can get more wrist snap, but then if you notice when they play the rest of the shots, the hand will come back onto their regular position. So the hand should not be further up, with the fingers should not be in the throat of the racket, because that will also cause problems with your hands or with your wrist. It wants to be right in the middle of the racket. And the next thing is the grip size. If the grip is too small, you'll often find that accidentally you're over squeezing. So you want to make sure that it's comfortable for yourself. Now in paddle, this is slightly different. You'll see some players with a really small grip and you'll see some players with a huge grip. It's more down to personal preference. So when you're playing, you have to think of it that your hand in the ready position and through most of the shot is relaxed on the grip. It's not squeezing hard. You only squeeze hard when you swing right up to the contact, and the contact itself is when you just gently squeeze on the racket and then you go back to a nice light hold on the racket. So this is something to consider when you're looking at your tennis elbow. The first thing, check your grip size. Second thing, make sure you're not over squeezing on the racket. The third factor is the racket. Now it might not be obvious to you that there are big differences between the racket, but there are some rackets that are extremely hard, there are some rackets that are extremely soft. The weight and the balance all can be a factor. If you've got a very hard racket and it's probably a heavy racket and you contact and you feel a vibration up your arm, that is probably something that is going to cause inflammation up your arm. So the best thing I could recommend for this is to experiment with the rackets. Try a softer racket, try a lighter racket, try a variety of rackets before you make your selection. You don't want to pick something that is too hard and therefore you're going to suffer from it, and because it's a new racket you don't want to change it either, and you end up stuck with a racket that is probably causing a little bit of damage to your elbow or your shoulder. The last factor is the amount you play. The difficulty with paddle is that players get addicted to it very quickly. So they go from playing 0 paddle to playing 10 or 12 or 14 hours per week in a very short space of time. It's not like they've accumulated up to that over a number of years. Normally within the first month, they end up playing an excessive amount of paddle. And that's something that you just got to be sensible when you're doing that. It doesn't matter if you've come from a tennis background or a non-racket sports background, the movements in paddle are different and your body needs time to get used to that. So my advice would be to be sensible with it, to build up the number of hours, and your body will suffer less for it. It's also really important to do the off-court exercises, the strengthening and preconditioning exercises that we'll cover in future videos. They will help on the court. I hope you found this video useful. Like I said, I'm not a doctor or a qualified physiotherapist, so if you're having serious problems with your elbow, please go and see a medical practitioner. If not, and you want to try some of these techniques that I know have helped players in the past and are helping players now, then please, by all means. Please make a comment if you've got any issues with the elbow or you have any questions, and I look forward to seeing you on the next video.